terms used in dermatology. Please pay a good attention now. One of the frequent terms you'll be hearing is macule and patch. Macule means color change within the skin. It can be red, it can be black. But that when the color change is less than 1 cm, but if you measure it, it is called macule. But then when the color change is greater than 1 cm, it is called patch. So macule is just color change. The next term is purple. Purple is a color change plus a rise in the skin. Something solid is under the skin that brings the skin up. Now, when you measure that solid something that pushes the skin upward and it is less than 1 cm, we call it purple. Then when it is greater than 1 cm, we call it nodule. For example, pimple is a purple because it is below 1 cm. Then lipoma is nodule because it's greater than 1 cm with a color change. So when you hear the term macula papula, it means, like in measles, it means color change with a raised skin from under, something raised, like a solid structure is under it. You hear macula papula rash. Okay. Then next term you hear is plaque. Plaque is also a raised area greater than 1 cm diameter. Okay. This time around, if you measure it by diameter, if you look at your screen, you see that it's greater than 1 cm, and it's kind of a plaque. It's very flat and it covers larger area of the body. Call it plaque. Okay. Then next term is vesicle. Vesicle are small eruptions, but in purple it is solid, but in vesicle it is water. It contains water. So that's the difference, and it is less than 1 cm. So the difference between purple and the vesicle is that vesicle contains little water, like in herpes, while macule contains solid structures. Okay. The next is blisters and bully. The difference is that in blister or bully, it is greater than 1 cm and it is large and contains fluid. So when you hear this, there's a disease we call bullous pemphigoid. It means that it contains bigger water, but when it contains smaller water, it's called blisters. Then you hear of pustules. Pustules are eruptions from the skin that contains pores. Then petechia is color change in the skin due to bleeding. Some persons, like when they use needle and take blood from your skin, that place will turn red. That is due to bleeding. Extravasation is called petechia or purpura. And lastly, I want you to understand that the difference between a rash and a lesion, because this and that term we also use. A rash, all these things I just show you are rashes. Vesicle, purple, plaque, they are all called what? Rashes. But when there is single growth, that is just one, like in cancers, we call them what? Lesion. Like in ulcer, we call them lesion. But when there are too many and covers extended area, we call all of them rashes.